The CDC Director, Dr. Rochelle Walensky, tonight making that big announcement that the CDC recommends the immediate resumption of the use of the one-shot Johnson & Johnson coronavirus vaccine. This decision follows a recommendation from an advisory panel to the CDC, which voted today to approve that recommendation after an all-day public meeting. That was fascinating if you dipped in and watched any of it. Dr. Walensky said tonight that the CDC used the 10-day pause they'd put on using this vaccine to collect data on a very rare but serious blood clot that was reported in a handful of people who got a dose of the Johnson & Johnson vaccine. What they found was initially they'd known about 6 cases. Ultimately, after this pause, they found a total of 15 cases, so 9 additional cases they learned of a rare blood clot. This is 15 cases out of about 8 million doses administered in the U.S. All of the 15 cases that they found of the blood clot were in women. 13 of the 15 women were between the ages of 18 and 49, which is interesting. Why is it only women? And why is it women under the age of 50? A CDC risk-benefit analysis determined that every million doses of the Johnson & Johnson vaccine administered would prevent hundreds of deaths and thousands of hospitalizations for COVID. And so, given the risk of this rare but serious blood clot, you do the math, the benefits of using the vaccine, they say, far, far, far outweigh the risks of not using it because of concerns about this rare side effect. Joining us now to field some questions about what this really means is Dr. Ashish Jha, Dean at the School of Public Health at Brown University. Dr. Jha, it's nice to see you. Thanks for making time to be here tonight.
Thanks for having me back, Rachel.
So what's your top-line reaction to this decision tonight from the CDC and the FDA? It was a very transparent process, including us all being able to see the ACIP discussions today and last week as well as they considered the data.
Yeah, so first of all, it was a very transparent process. Everybody could see all the data, all the discussions were out in the open, as it should be. I totally agree with the decision. I'm not sure that the 10-day pause was totally necessary. These are incredibly rare events. That said, they did it out of caution. I think that's fine. And now it's time to resume it. These are really, really safe vaccines. There's no drug, no vaccine that's completely risk-free. These are among the safest vaccines we have out there. I think that they made the right call by resuming it.
One of the things that's interesting is that among the cases they identified of this rare side effect, which led to the pause, which they say they've now evaluated and considering them, it's still safe to resume the use of this thing. They do seem to be confined to a specific demographic. It's women, basically women under the age of 50. I think the first 6 cases, they were even able to say it was all white women. Do we know anything about why there might be demographic specificity to this side effect and whether that should or could sort of inflect the way that specific vaccines are recommended for specific people?
Yeah, it's a really good question. It is a bit puzzling. I'll say 2 things. I mean, first is that the specific type of blood clot, which is very rare, does happen in people other than obviously under vaccination standards, and also happens more often in young women. So that's interesting, and it suggests that there's a broader phenomenon. And the second is that this one seems to be immune mediated, that there's something, again, very, very rarely your immune system has a reaction and that triggers that clot. And we know that autoimmune conditions are also more common in women. So we don't know. Obviously, the biology here is not well understood. It is thankfully very, very rare, but there does seem to be that pattern. And I suspect as the science gets sorted out, that phenomenon may very well be borne out that it is among young women primarily.
And again, I don't mean to make more of this side effect than it needs to be. As you say, you aren't sure that the 10-day pause was necessary given the infrequency of this side effect. But because people do know about it and it is going to be on their minds, I was interested to see Dr. Francis Collins, head of the NIH, say today, quote, "This is a treatable condition if you recognize it right away. One of the reasons it's been good to have this pause is to get everybody apprised of that so physicians know this is something to watch out for and can be prepared to treat it appropriately if it should happen again in the future." Is that true? And do enough clinicians know that?
Yeah, it is true. It requires a very specific type of treatment. And I think one of the reasons for the pause was to help physicians understand that you don't want to use standard blood clotting or anti-blood clotting therapies. There are different therapies for this one. And I think that has now gotten out there. And most physicians, I think, are now well aware of this. because it has gotten so much attention. So I think the attention is good. I think the publicity is good. I think the transparency is good. And if it happens again, and physicians will be on guard for it and will be able to treat it appropriately.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.